Welcome to your orientation of Neurova's preclinical therapy systems. We have some important information about your therapy to share, but let's start by clearing up a very common confusion about hearing aids. If you are experiencing progressive hearing loss, you're going to think and talk about this problem in terms of the word hearing. A family member might say to you, "Honey, are you losing your hearing?" A hearing aid professional might say, "Mr. Smith, you've lost 40% of your hearing. You need hearing aids." Hearing aid advertisements focus on how hearing aids can improve your hearing. You get the idea. When we talk about hearing, we tend to equate the word hearing with the word understanding. When a person with hearing loss says, "I need to hear better," what the person assumes is that hearing is the same as understanding better. That is not a correct assumption. Hearing better does not automatically mean that a person will understand flowing conversation better, or anywhere near the level that we assume and hope. While most individuals may think of hearing and understanding as being interchangeable terms, which is reasonable, professional hearing aid dispensers do not. Hearing aid manufacturers do not. Their services focus on how clearly the hearing aid will amplify sound, period. They do not claim that their product's features or listening programs improve comprehension to any specific level or degree. It's because those features do not have that capacity. In the right hands, hearing aids can be wonderfully effective devices if their programming is based on the medical sciences. But there is no requirement for any professional in auditory care to become proficient in any of the subjects RTP mentions on the videos or on the website. This is what makes the Neurova treatment systems so unique. Every single aspect of Neurova, including how to program hearing aids, is based on advanced principles in the medical sciences. It's critical to understand that while hearing is a talent, understanding what you hear is the result of the development of the most complex skill that a person can achieve. Understanding language is a skill, and like all skills, they can be learned and they can be unlearned. The question here is, how do we recover the skills that have been lost because of hearing problems? In our seminars around the country, we use the following examples to put this in perspective. Two co-workers decided to get in shape for the annual race to raise funds for charity coming up in 4 months. James is a 60-year-old smoker who hasn't worked out in 10 years. He is 30 pounds overweight and takes meds for high blood pressure. He still eats fast food every day and drinks coffee and Cokes instead of water. He hasn't run a mile since the last time his hair was on fire. Shirley is a 50-year-old in relatively good shape, but hasn't worked out in 6 months because of the demands of her new job and her newborn twins. She is 10 pounds overweight but has a healthy heart. She doesn't smoke. She drinks lots of water and eats healthy foods. There are 2 ways to get in shape. One is to do it yourself. So they go to the sporting goods store and get the best equipment money can buy. Neither of them are experts in physical fitness, but they have heard their friends talk about which exercise programs seem to work, so they tape the same workout routine to their fridge. The other way is to join a fitness center. So they go and meet Rocky, their personal trainer. He has an up-to-date education in kinesiology and exercise science. He is a certified personal trainer through the National Strength and Conditioning Association and specializes in weight loss, weight management, and cardiovascular training. After reviewing James and Shirley's initial questionnaires, Rocky creates individualized workout plans. James and Shirley's medical conditions, health, diet, and other factors helped Rocky create the ideal pathway for them to follow. Rocky's education and experience put it all together. Now it's up to them to follow through. The most important factor is Rocky's education and experience, not the equipment that will be used in the workouts. James and Shirley will have unique experiences. James will require months of effort and participate in more carefully managed exercises. Shirley will require just weeks of effort that will involve a faster, steeper workout. After creating the workout plans, Rocky will make adjustments to match how James and Shirley's bodies are responding, and will provide support and motivation along their journey back to optimal conditioning. Which workout plan would you choose if you were James or Shirley? In these examples, Neurova is both your neuro fitness center and your personal trainer. And the people who buy hearing aids online or through mail order or big box stores are going to have to recover their fluent comprehension on their own after they buy the equipment they believed would do the job. Even the rehab software products on the market today are a lot like the do-it-yourself workout routine because none of them are patient-specific, nor are they based on neurosciences, cognitive principles, or neural information processing strategies. Hearing loss is a complex combination of sensory, hearing organ, and neural conditions. It is now indisputable that you will not recover the highest degree of your original language skills without being a part of a neuroscientifically based and medically focused neural rebuilding program. In healthcare, you have every right to expect a high level of expertise and experience when needing medical attention. Neurova is the only treatment system which provides it. What can make this confusing is that in hearing care, there is still a huge disconnect between the kind of experience we need as patients and the kind of approach that dispensing specialists take toward the public as consumers or purchasers. Neurova takes you far beyond that. With Neurova, the experience, training, and expertise that you are getting is exactly what is necessary to treat your hearing loss based on routinely acceptable healthcare principles. With Neurova, if you have to have amplification, the formula that is used is not just based on your hearing test. It is based on your medical condition, your cognitive training history, the duration of your hearing loss, and many other factors commonly taken under consideration by healthcare professionals to determine how to treat you as a patient. In addition, the therapeutic sessions that you are now starting are based on all of these factors as well. Even if you're a Vanguard patient and your hearing is technically so mild that you can't get hearing aids, you can greatly benefit from Neurova's treatment service for you. One of the reasons that Vanguard is effective without extra amplification is because you still have enough functioning synapses and other neurocomponents for us to work with to achieve your goals. It's a bit like Shirley from our earlier example. Since we understand how the brain naturally amplifies certain sounds, we can take advantage of that knowledge at this particular time in your hearing loss experience. The only way that that can be taken advantage of is through the creation of our medically based therapeutic system. If you are a Coralex patient, Neurova links the amplification with the therapeutic exercise requirements. This means that we know exactly what you are hearing versus what you cannot hear. When we factor in all of the other personal criteria, we know exactly how to create an ideal treatment plan just for you. No other software or process available today can achieve anything close. Your therapeutic process is going to renew, restore, and rebuild the system in your brain to the largest degree possible, and in the shortest time period that is possible. But the first thing to understand is that you need to be patient while you're going through the therapeutic steps, and you need to hang in there and take your therapy every day, just as if it were a life-saving medication. It needs to be a high priority, but the good thing about it is that you don't have to do this for the rest of your life. Once you recover the highest degree possible, you'll be able to manage sounds out in the world in a much more effective way.